is associated with insulin resistance and obesity. It is also associated with abnormal hair growth on the face or body, and acne as well is the most common cause of fertility issues or female infertility. So if you see here, if you look at the characteristics of PCOS, you see that it has a lot of issues. It has a lot of issues. So you'll see that PCOS has to do with hormonal imbalance. It has to do with insulin resistance. It has to do with abnormal hair growth. It has to do with acne. And all of this makes PCOS the very top reason why you have issues conceiving. So PCOS is actually the main reason why you're having problem with your ovulation. Now, it does not mean that if you just have maybe hormonal imbalance and maybe facial hair, you start bothering yourself a lot that you should have PCOS or polycystic ovary syndrome. We know PCOS is one of the top reasons why you have hormonal issues. You have ovulation problems. You have ovulation issues. But don't just confirm at home. Maybe you're at home and you confirm that it's common because I have enough facial hair, I have enough hairs on my body as a lady, so I should have PCOS. No, PCOS is not something good for ladies. PCOS actually causes serious problems when it has to do with your fertility. But before you diagnose, do not diagnose at home. Before you start complaining, don't diagnose at home. Make sure you can visit your doctor, and your doctor should be the one to diagnose you. And obviously, if you are diagnosed, you'll be given treatment. So that's why your doctor should be the one to diagnose you, so that once you are diagnosed, you will be given treatment to solve your problem with PCOS. So PCOS is the first reason why you have ovulation problem, PCOS. So it's associated with insulin resistance, associated with obesity, associated with abnormal hair growth on the face and body, associated with acne as well. So if you have all of these, then there is a higher probability that you could have PCOS, and there is also a higher probability that your ovulation might not come frequently. So you might have an infrequent ovulation. So that is for sure. And you should always try your best to make sure that if you have all of this and you've been trying to conceive and it's not coming, you talk with your doctor. Make sure you talk with your doctor, and your doctor will probably look at it and follow you for you to. Have a question, please try and put it in the comment section. Pretty Naomi, welcome. Thank you, thank you, thank you, thank you. You're getting up at this time to do upload or how? Because I hardly see you. You've been really busy. So PCOS, polycystic ovary syndrome, that's among the very top reasons why you have ovulation issues. Can cause what? Hormonal imbalance. That's what you should know. Can cause hormonal imbalance. And because of this issue that it can cause hormonal imbalance, that is why it is linked to ovulation problems. Anything that can cause hormonal imbalance is linked to ovulation problems. We need to just take note about that. Anything that is linked to hormonal imbalance can cause ovulation problem. That's why you will see that even stress for ladies, please, I understand that as ladies you have a lot of things, you have family, you have the kids, and you also have a lot of things disturbing you normally in life. But please, you need to reduce stress, especially if you're trying to conceive. You need to reduce stress, because you will see in later discussion that stress is a major factor. Stress is a major factor. So you're going to see that stress is a major factor. Now, the next thing under PCOS, like I said, if you have a question, please make sure you put in the comment section. What we have discussed like that is the first reason why you have ovulation issues. And we said the reason is PCOS. PCOS, which is polycystic ovary syndrome. Or you may just simply call it PCOS, polycystic ovary syndrome, or PCOS. So it's one of the main reasons why you are having ovulation problem, one of the main reasons why you have issues with conception. So we are going to move to the next reason why you have ovulation problems, why you have issues with your ovulation, why you might not be ovulating, why you might not be ovulating at the right time. The next reason is hypothalamic dysfunction. Hypothalamic dysfunction is the next reason. So two hormones produced by the pituitary gland are responsible for stimulating ovulation each month. Now, this is so vital. We have two hormones that are responsible for stimulating ovulation each month. We have two hormones. So we need to take special note about this. These two hormones are follicle stimulating hormone and luteinizing hormone. But these hormones are being produced by the pituitary gland. Remember, this is the second point we are talking about factors affecting ovulation or ovulation problems. Hypothalamic dysfunction. Hypothalamic dysfunction is what we are discussing now. So, hypothalamic dysfunction, we are discussing about the hypothalamus, which is a part of the brain. You should take note that this hypothalamus is a part of the brain. So, you need to take note that this hypothalamus is a part of the brain, and there are two hormones produced by this part, by the glands of this part of the brain. That's the pituitary gland. And these two hormones are responsible for stimulating ovulation each month. So it therefore means if you have problem with your pituitary, then that will be difficult for you to ovulate. If you have problem with your hypothalamus, which is that part of the brain that stimulates, that produces these hormones, and for the hormones to stimulate production of your egg. So if you have problem with your hypothalamus, then it will be difficult. So these two hormones are the follicle stimulating hormone and the luteinizing hormone. They are responsible for stimulating ovulation each month. And where are they being produced? They are produced in the pituitary, that is in the brain. So if you don't have this hormone, that's the follicle stimulating and luteinizing hormone, of course, ovulation will be hard for you. Ovulation will be hard for you. So two hormones produced by the pituitary gland are responsible for stimulating ovulation each month. Follicle stimulating hormone and luteinizing hormone, excess physical or emotional stress. Now, this is important. Excess physical stress, high or very low body weight, or a recent substantial weight gain or weight loss. So these are all things that can cause hypothalamic dysfunction. So for those who do exercises, take note that if you lost weight suddenly, it's possible. It's possible for you to have fertility problems. So if you gain weight abruptly or you lost weight abruptly, it's possible for you to have problems with your ovulation. We should take note about this. So this is important for us to eat wisely such that you don't just gain weight at the speed of light, or when losing weight, don't just lose weight too at the speed of light. So we have seen that we have two hormones produced by the pituitary gland, and these are responsible for the stimulation of what? Ovulation each month. So the follicle stimulating hormone and the luteinizing hormone are responsible. These are the two hormones responsible for ovulation. Without this hormone, you will not ovulate. That is why we have been saying that if you have problem conceiving, make sure that you check your hormones. If you have problem conceiving, make sure that you check your hormones. Do not just stay. Make sure you check your hormones. Your hormones should be among one of the first things you should check. It's proper that it is proper, better that you check and there is no problem than for you to stay whereas there is a problem. So excess physical exercise, excess emotional stress, these are all things that can cause you issues. A very high or low body weight, a risk or a recent substantial weight gain or weight loss, weight gain or weight loss, and or absent periods are the most common signs. So if you have problem with this particular part of the brain, there is a probability that you start having skip menses, your period starts skipping. Yeah, there's a probability that period starts skipping. So the next point under ovulation problem is premature ovarian failure. Premature ovarian failure, also called primary ovarian insufficiency. Primary ovarian insufficiency is another name for pre-ovarian failure, and this is the third reason why you have ovulation problem. Remember, we have talked about the first reason, which is because the other reason, which has to do with your part of the brain, that's the hypothalamus. Then we're talking about ovarian failure now. Premature ovarian failure, also called primary ovarian insufficiency. So premature ovarian failure, also called primary ovarian insufficiency, this is actually a disorder usually caused by an autoimmune response or by premature loss of eggs from your ovary, possibly from genetics or chemotherapy. The ovary no longer produces eggs. The ovary no longer produces eggs, and it lowers estrogen production in women under the age of 40. So this is dangerous. Although this is not caused by you, there's nothing you can do as a lady if you have this one, in the sense that this is not caused by you, and no matter what you do, you will only try to correct it. This is an autoimmune issue. An autoimmune problem has to do with your own system attacking itself. So your system is attacking itself, then that's autoimmune issues. That's autoimmune problem. The next cause of ovulation problem is too much prolactin or hyperprolactinemia. So too much prolactin or hyperprolactinemia is the next thing that can cause ovulation issues. So hyperprolactinemia, the pituitary gland may cause excess production of this prolactin. And you see that it is linked back to the pituitary gland. Yes, it's linked back to the pituitary gland. Estrogen production and may cause infertility, usually related to a pituitary gland problem. This can also be caused by medications you are taking for another disease. So medication you are taking for another disease may cause reduction in estrogen, and if there is a reduction in estrogen, then it is possible that you could have hyperprolactinemia, increased levels of prolactin. So that is a brief we have concerning ovulation problem. That's a brief we have concerning ovulation problem. I will just do a summary of this. Remember, we are talking ovulation. Remember, we are talking ovulation tracker. Remember, we are talking ovulation problem. So anything ovulation is what we are discussing today. So we have said that ovulation problem being caused by these particular disorders. So the very first is polycystic ovary syndrome. That's because so ovulation problem being caused by the following. The very first is polycystic ovary syndrome. Polycystic ovary syndrome is something that some ladies are passing through, and if you're passing through, make sure you meet with your doctor, surgeon. It can be self. Polycystic ovary syndrome has to do with hormonal imbalance, which affects ovulation. Polycystic ovary syndrome, or PCOS, which is PCOS, is associated with insulin resistance and obesity. It's also associated with abnormal hair growth on the face or body and acne as well. Polycystic ovary syndrome is the most common cause of female infertility. The next point, the next issue that can also cause issues with your ovulation is hypothalamic dysfunction. Hypothalamic dysfunction. Hypothalamic dysfunction here has to do with two hormones that are produced by the pituitary gland and are responsible for stimulating ovulation, and at the end of each month, these hormones are follicle stimulating hormone and luteinizing hormone. So these are the two hormones that are being produced by the hypothalamus. So if you have issues with your hypothalamus, maybe it does not function very well, then know that you might have problems with the production of some of your hormones. And if you have problem with the production of some of these hormones, it will probably affect your cycle as well. It will affect your ovulation too. So two hormones produced by the pituitary gland are responsible for stimulating ovulation each month. Follicle stimulating hormone, which is FSH, and luteinizing hormone, which is LH. Excess exercise or emotional stress, a very high substantial weight gain or weight loss can disrupt production of these hormones and affect ovulation. Irregular or absent periods are the most common signs of this particular point. The next is premature ovarian failure. Premature ovarian failure is our next point, our next reason why you have ovulation problem. This premature ovarian failure is also called infertility. ovarian primary ovarian insufficiency. Primary ovarian insufficiency has to do with disorder usually caused by an autoimmune response. And with this, there is little or nothing you can do apart from feeding well. The ovary no longer produces eggs, and it lowers estrogen production in women under the age of 40. Too much prolactin, the pituitary gland may cause excess production of prolactin, hyperprolactinemia, which reduces estrogen production and